Hi everyone, my name is Dr. Tammy Hendriksz. I am a pediatrician, I'm a medical educator, I work as an associate dean at a medical school, and I'm a mom of 2 small children. Earlier this week, I gave a coronavirus update to our medical school campus. I have also been inundated with requests from family and friends to help educate them about the situation. So I put together this presentation specifically for family and friends so that they can know a little bit more about what's going on. You'll see the date of this presentation is March 20th, 2020. It's important to note the date because everything changes so quickly with what we currently have going on. So every minute, every hour, every day, we are learning more information and we're finding out more about how this disease is impacting our global world. I wanted to start just by sharing some quick facts so that everybody can be educated with the same information. COVID-19 is a disease that's caused by a new coronavirus. That name of that coronavirus is SARS-CoV-2. It emerged in China in December of 2019. It is brand new, so the entire world is still learning about it. There are other coronaviruses that we've had out in our population, probably coronaviruses that you and I have caught. They've given us common cold symptoms. There have also been some more serious coronaviruses like SARS and MERS that have caused some more serious infections. This one is new and different compared to any of those. And like I said, the entire world is still learning about it. The symptoms for COVID-19 include cough, fever, and shortness of breath. There are a number of other symptoms that may be associated, and it depends on the person who gets it and how their body reacts to it. Other symptoms that people have reported include runny nose, diarrhea, stomach pain, some headaches, some sore throat, could be any of those. But the primary symptoms that we're watching for are cough, fever, and shortness of breath. COVID-19 spreads from person to person through respiratory droplets. This means that when one person sneezes or coughs, they are putting bits of the particle out into the air that somebody else can catch. This is why we say that we need to stay 6 feet apart, because we're trying to stay far enough away from another person that if they were to sneeze or cough, we wouldn't be at risk of inhaling any of those respiratory droplets. Right now, it seems that the incubation period is anywhere from 2 to 14 days. That means if you're exposed to somebody who has COVID-19, you may start to become symptomatic or you may develop the disease yourself within 2 to 14 days. Longer than 14 days, and it's unlikely that you will develop the disease. This is why when people are put on self-quarantine, that self-quarantine is recommended to last for 2 weeks. Once you're outside of that period, if you haven't developed fever, cough, or shortness of breath, most likely you haven't caught the disease. The people that are at greatest risk of catching the disease are those that have prolonged, unprotected, close contact with symptomatic patients. That means a patient who has COVID-19 who is actively coughing, has fever, has shortness of breath. As you can imagine, the people with prolonged, unprotected, close contact primarily are our healthcare workers. This is why it is so important that we make sure that we don't hoard masks ourselves, but we give masks and other personal protective equipment to our healthcare workers so that they can stay protected. One of the things that we've seen, especially recently, is that the people that are at greatest risk of developing the disease include the physicians, the nurses, the medical assistants, all of the people who are working closely in the hospital and healthcare systems to help these patients. COVID-19 can cause a spectrum of disease, from asymptomatic, meaning you don't have any symptoms at all, to respiratory failure and death. We have seen that this disease can be very, very dangerous. We have also seen that this disease can spread very easily. So people who don't have any symptoms at all may be going around and spreading the virus without even knowing about it. This is why it's so important that when we're told to shelter in place or make sure that we're socially distancing ourselves from other people, that we're actually doing it, because we can't tell just by looking at somebody if they may have the virus. Older adults, meaning people greater than the age of 65 years, and those with chronic underlying conditions, especially conditions that leave you being immunocompromised, like having cancer or receiving chemotherapy, are the people who are at greatest risk of developing those severe infections, leading to respiratory failure. We have also seen that there is also a risk with young, otherwise healthy adults. We're also seeing quite a few children can be impacted by this disease. Initially, when we were first starting to learn about the disease, it seemed that it spared children, but now we're finding out that that isn't the case. Initially, we thought that if children tested positive for some other infection, like the regular flu or RSV, that meant that it was very unlikely that they also had coronavirus 19. Now we are finding out, because we're starting to test more kids, that they can have co-infections. Actually, right now, it seems that the rate is at as high as 40%. So a child could have COVID-19 and also have flu. So nobody is safe from this. Doesn't matter where you're from, doesn't matter what your age is, no one's safe. But the people who seem to have the most severe infections include those older adults and people with chronic underlying conditions. Right now, we can diagnose COVID-19 with oropharyngeal. That means taking one of those long Q-tip things and putting it all the way in the back of your throat, an oropharyngeal swab, or a nasopharyngeal swab. Actually, we usually use both. So that's one of those long Q-tippy things that we're sticking up into the nose and pushing back into the back of the nose. So an oropharyngeal and a nasopharyngeal swab. There are different tests that take different lengths of time. Some of them are as quick as a few hours. Some of them take up to 5 days. It depends on which tests are available in the area that you are. We have found that COVID-19 can stay on surfaces for hours to days, especially hard surfaces. This is why it is recommended that we are disinfecting any frequently touched surfaces, like our doorknobs, like our light switches, like our phones, our computers, our tablets. This is why, even though I still take my kids out to the park, we're lucky enough to have a couple playgrounds close to where we live, I still take them out there and I let them play on the playgrounds, but as soon as they come off of the playground, I'm making sure that we are washing their hands really, really well, bringing both the some hand sanitizer along with us, as well as other disinfectant wipes, so we can make sure that they're staying really clean. So maintaining social distancing, but still allowing to have some fun. There are trials starting for both treatment and for a potential vaccine for COVID-19. One of the nice things about our world being so connected by technology these days is the physicians, scientists, people in the healthcare settings around the world are able to work together to quickly find out as much as we can about this virus and what the best treatment mechanisms for it are. And then finally, as of now, there's no post-exposure prophylaxis. This means that if you are exposed to somebody, especially someone who is symptomatic, so they have that fever, cough, and shortness of breath, who has COVID-19, they get tested and they test positive for it. As of now, there's nothing that we can give you to help protect you from potentially developing the virus or developing the disease. But as I said, people are constantly looking into new ways that we can help protect everybody for this. So as of today, and this information comes from the European Centers for Disease Control, the ECDC, this is where we're seeing this pandemic affecting around the world. You'll see the countries that have the darker colors are the countries that have the heaviest infection rates. If you check back at this website, and you'll see I left website links for each of the slides so that you know where I'm getting the information from. You check back at these websites every day things are a little bit different. This pandemic continues to spread exponentially. Just to give you the numbers, as of today, and this has probably already changed from the time that I am recording this, there have been 242,000 cases reported worldwide, with over 9,000, almost 10,000 deaths associated with COVID-19. This is from the United States Centers for Disease Control. And once again, this is just as of today. So we can see the number of cases across all of the different states. Once again, the darker color indicates those states that have higher number of cases. And as of today, once again, this is probably already changed because we're seeing the exponential growth of this. The total number of cases in the US is greater than 15,000 individuals. Total number of deaths is just greater than 200. And we can see all of the states are impacted. This graph is again coming from the European Centers for Disease Control. And this is showing you the distribution of COVID cases from when we first learned about the disease back in December of 2019 until today. And we can see that those cases have increased dramatically. What I want to point out on this slide is the blue color indicates the cases originating in China. Also, if you look along to the axis on the side, you can see 5,000 cases is the very lowest point. So far below that, right, is when we first started seeing just 1 or 2 cases, maybe a handful of cases, 5, 10, 15, even 100 cases barely show up on here because there have been so many. But what I like about this slide is if we look at China and we use China as an example, that's where the virus first showed up. That's where we first identified it. They saw this huge exponential growth of what was happening there, of the number of diseases and number of cases they were having. And then we saw that come down. So if you look at just the blue, it has gone all the way up and then come down, so that now they're actually able to close down some of the emergency shelters that they had to build for patients because their hospital system was overrun. They're actually able to start opening up more of their stores and get people out and about again. So it tells us there can be an end in sight as long as we treat it appropriately, as long as we know what we're doing and what we're getting into. We can see outside of China, all of the cases have just continued to exponentially increase. This is from the United States Centers for Disease Control. Their most updated slide on this gives us the data up to March 18th, so up to a couple of days ago by the time of this recording. And we can see the number of cases just here in the United States, and we can see that exponential growth. This graph gives us the picture that maybe things are starting to slow down, but as they indicate on the graph, really that decrease most likely represents illnesses that have begun but have not yet been reported, maybe haven't been tested yet. What we have seen is once we get all of the test results in, we have just seen the steady increase. We have not seen a decrease at all. You've probably heard a number of people use the phrase flatten the curve. So flatten the curve is directly related to that exponential increase of the number of cases. We know that this virus can, in some people, be totally asymptomatic. They won't have any symptoms at all. In other people, they may have kind of like cold symptoms, maybe a little bit of a cough, maybe a low-grade fever, nothing too bad. In some people, they do get very, very sick. And the higher numbers of people that we see who have this disease, the higher numbers of people we're going to see who also are very, very sick and need hospitalized care. What we saw in China, what we're currently seeing in Italy, what we are preparing for here in the United States is that the numbers of people who need to be hospitalized and who need good health care are going to increase exponentially so that it reaches and crosses the healthcare system capacity. When we talk about the healthcare system capacity, we're talking about the number of beds that we have in each hospital. We're talking about the number of ventilators, so how we can help patients breathe when they go into respiratory failure, the numbers of those we have, how much oxygen we have, how much personal protective equipment like masks that we have for our healthcare providers so that they stay healthy, right? If we cross that healthcare system capacity limit, then suddenly we can't care for all of the sick people. So ideally, if we take really serious measures, which is what we are all promoting right now, we can decrease how quickly the disease spreads and keep those numbers of really sick people within the healthcare system capacity so that we are able to care for all of them. This is my favorite version of the flattening the curve, because we all know that the internet is great for cat videos and cat videos alone. This is called cattening the curve. This is not at all something that I did. This is a meme that I'm sure most of you have seen because it's pretty fantastic. I wish I knew who created it so I could give them credit. But cattening the curve, we have this alert kitty outbreak, right, which represents that really rapid increase in the number of cases. That alert kitty is going to pounce and shred the healthcare system like the arm of your couch. What we really want is the lazy kitty outbreak. Long intervals between transmission events, like the amount of time the kitty will hold this position. The healthcare system can then cope. So what can you do? Protect yourself. Wash your hands, right? And you've heard this so many times. The best is to use soap and water and to wash your hands for at least 20 seconds. Remember to get between your fingers, remember to get your wrists. Those are the areas that we most often forget when we're washing our hands. So wash your hands really, really well with soap and water. If you don't have soap and water available, like when I take my kids to the playground, you can absolutely use hand sanitizer. Just make sure that hand sanitizer is at least 60% alcohol-based. So the natural hand sanitizers that don't have any alcohol in them aren't going to be effective or not nearly as effective. Social distancing, avoiding crowds, staying at least 6 feet apart from other people. I will say that we recently had been planning to go on a trip with a couple of friends. We were really looking forward to it. Quite frankly, we could really use it. We're going to go up to the snow. And the risk, even just with being with a couple of friends, a couple of families, is just too great. So we are not doing that trip. We are staying at home. We are continuing to practice our good social distancing and doing what we can, right? For every individual that you come in contact with, that just increases the risk that much more. Going to increase the potential of continuing the spread of this virus and this disease. Stay at home if you're sick. That's huge. Even if you're not that sick, you just have a little bit of a runny nose, a little bit of a sore throat, stay home. It is not worth the risk to spread this virus to other people. Also, if you're sick, it is still flu season. I still in my clinic see a number of patients that have flu, test positive for flu, as well as for strep throat. So if you are already sick with something else, you don't want to catch another virus on top of it. Now we know that it can be co-infected, right? So you can get both together. Let's try to keep our immune systems as robust as they can be. So when you're feeling ill, please stay home. Cover your sneezes and coughs. If you are sneezing, if you are coughing, please cover them, ideally with a tissue that you can then throw away and then wash your hands. Avoid touching your face, right? If we were to touch anything where the virus is, remember it can live for hours to days on any hard surface. We were to touch that hard surface like a doorknob, like our phone, which we just took into the store with us, and then we touch our nose or we touch our mouth, that's how the virus can get spread. And then clean and disinfect frequently touched surfaces regularly, especially those hard surfaces, phones, keyboards, tablets, doorknobs, light switches, handrails, all of those, clean them regularly. I use Clorox wipes. I actually have some right here because we use them so often in my house. But the Clorox wipes are great, and those are in the EPA, the Environmental Protection Agency. That they're in their list of good disinfectants that you can use for this. You can even wipe your phones, your keyboards with those. So make sure that you're keeping up with that. And then manage stress and anxiety. The stress of this is huge. Take breaks from the news. Take care of your body. Like I said, to keep your immune system as robust as it can be, but also to help manage your stress. Make sure that you're getting enough sleep. Exercise every day, even if it's just going for a walk. Eat as many fresh fruits and vegetables as you can. We're limited to how often we can go to the store right now, or at least we should be limiting ourselves. We don't want to have that much contact. So if you can't get fresh fruits and vegetables, frozen fruits and vegetables are still great. They're usually flash frozen right at the peak of their ripeness level. So they're still going to give you great benefits, great vitamins that are really going to help to benefit you. And then avoid, right, all of those unhealthy coping mechanisms, excess alcohol, excess drugs, right? Try to keep ourselves as healthy and as sane as we can be. Make sure you take time to unwind, doing things that you enjoy, and connect well with others. Actually put connecting with others onto your to-do list. Make sure that you are setting up time to FaceTime, to Skype, right? Even you can do virtual dinner parties where you set up your computer or pull out your phone, open up FaceTime or Skype or Zoom, and then have your friends do the same so that we're just connecting with each other even while we are so separated. And then some special considerations. Children, like I said, I'm a pediatrician and I'm a mother. All of you who work with children know just how much kids pick up, even when we don't think that they are picking up what we're talking about or what we're worried about. If you are stressed and anxious, I can almost guarantee that your child has noted it and they are probably feeling stressed and anxious as well. Those people who live where I live, our schools are all closed down, so all of our kids are home. Make sure that you're making it a fun time for them. One of the reasons that I wanted to go into pediatrics, one of the reasons that I love my job so much, is because kids always love to play. It doesn't matter how sick they are. It doesn't matter what's going on. They always have that sense of spark and joy inside of them. So continue to seek that out. It's going to help you as much as it helps them, right? And protecting our most vulnerable populations, of which kids are definitely one of them. So make sure you're protecting their mental health as well as their physical health and everything else. Sharing information. Please be wise about the information that you share. I see so much misinformation being shared about COVID-19. There's a meme going around that says that the virus starts in your throat, and if you just gargle with salt water, that'll help fight the infection and then you'll be free and safe from it. That is a dangerous meme to share because it is not true. People may read that and think, okay, then I can go about my regular daily life. I can go to the store, I can interact with friends, I can avoid all of these recommendations because I'll just gargle with salt water every day and then I'll be protected. That's not how the virus happens. That's not how you get sick. So please make sure if you're going to share information, you are only sharing solid information, the information that we know to be true right now. It's part of the reason why I'm making this video. Healthcare workers. Your healthcare workers, the doctors, the physician assistants, the nurse practitioners, the nurses, the medical assistants, every healthcare worker right now is stressed. We're nervous that we are going to bring the virus home to our families. We're nervous that we're going to get sick, as we have seen so many of our colleagues get sick across the globe. We are nervous that we're going to reach that health system capacity threshold and not be able to help everybody in the best ways that we could. So please, if you know somebody who works in healthcare, be kind to them right now. Please offer to help them. Healthcare workers also don't have enough personal protective equipment. We don't have enough of the good masks, the N95 or H95 masks. If you have any of those, please donate them to your local hospitals. We need them so that we can stay healthy, so that we can help everybody else to recover from this. And stay connected. It's hard during these times. We're stressed, we're nervous, and we're told to socially distance. But it's so important to stay connected. Finally, I wanted to give you a list of some reliable resources. So if you do choose to share some information, you know that you're sharing quality information. The World Health Organization, the CDC, the United States Centers for Disease Control and Prevention, their section on COVID is fantastic. They have sections on coping, dealing with the stress and anxiety related to it, helping children to cope. American Psychological Association also has some similar sections on the coronavirus anxiety that's associated with it, right? When we're talking about keeping our immune systems as robust and keeping ourselves as healthy, it's not just our physical bodies, it's our mental bodies, right? Everything's connected. So we want to try to keep everything as healthy and strong as possible. That is all that I have for you. For the majority of my educational videos, I usually make them as either unlisted or private YouTube videos that I just share with our students in our campus. This one I am going to make public, so feel free to share it if you find it helpful. I also am interested in potentially putting together one of these specifically for children so that we can help kids to learn more about this. Like I said, they're listening to us. They know that we're feeling nervous and worried about this. So to be able to give them some facts in a non-scary manner, to let them know all the help that we have out there and what we can do about it. So if you're interested in that, please let me know as well. Thank you so much. Please stay safe out there. Wash your hands, maintain your distance, but stay connected. Thank you so much. Have a great day.